All right, everybody. Good morning. Welcome to Health Talk. I am Peter Kristin. That's the immortal, almost immortal John King over there. How are you doing, John?
Good. I don't know how I get immortal after living less than a fifth of your lifespan, but yeah, what's great.
A fifth of my life? Wow. I'm 160 years old. What do
you
think about
That's
that?
quick math.
He hasn't actually been carbon dated yet. We don't really know.
We'll send him to the Museum of the Rockies here shortly.
I don't slow down long enough for them to take any of my bone marrow. Anyway, Dr. Kristin Anderson is joining us here in studio again. I hope you found your designated parking spot outside.
Thank you so much.
Yes.
That was perfect. I expect a sign next time if you could go ahead
There
and do
was.
that.
It might have been in the snow.
We need to get you a lanyard with your with your ID. Anyway, welcome to the show. It's
Thank
good to
you
see
so
you
much.
again. Did you have a happy
I
Thanksgiving?
really did. How about you?
Yes, I am about 15 pounds heavier now.
Sure. Well,
So.
Let's
my,
talk about it.
My parents did the whole Thanksgiving thing. They had 4 kids, right?
Right.
But only one lives here now.
Oh, now did you have people coming in and
No,
lots of
no.
Oh,
But
no.
the meal was exactly the same. So I had to clean up on all by myself, which was a little bit more tough.
You're expected to do forple duty.
We'll be eating for a while.
Did you do something wrong?
We're
to
like
have to clean it all
Thanksgiving
up?
hoarders, cramming things on different levels of the refrigerator that don't exist yet.
Exactly. Pumpkin pie with turkey gravy, kind of a weird combination.
Yeah.
But we make it work somehow. So Dr. Anderson, tell us a little bit, in all seriousness, people do tend to go a little bit overboard during the holidays. We just have the first, wave, if you will, of stuffing our faces. So where should we be? What should we be thinking about right now?
Well, the conventional wisdom is try not to put on weight right now. I think that's probably the most important thing. You're probably not going to be able to lose any weight, and I think it's important to set realistic goals. If you're trying to lose weight or maintain your weight at a certain level, now is not the time to go on a big diet because you're going to set yourself up to fail.
Okay,
There's just too much out there.
Let me ask you this. When we look at the traditional Thanksgiving meal, you got turkey, you got mashed potatoes and stuffing, and the green bean casserole.
That's right, yep.
All that stuff. So, is there anything on there that is specifically unhealthy for you?
I'm one of those people that believes in moderation sort of thing. I mean, no, what's wrong with turkey? What's wrong with the green beans? It's the stuff that we put on it. It's the stuff that goes in and around and the nooks and crannies and all of that can get you into trouble. But
Gravy.
right. Which I will say, I'm a big gravy fan. But there are two times a year.
You put gravy on gravel, I'll
exactly
eat it, okay?
right, on Cheerios.
I'm literally bigger gravy fan, actually.
But it's the portion sizes. So, I'm probably not even going to try to tell you to limit it on Thanksgiving, but I think what you do need to do is be smart about it. You don't need to, load up your plate and eat till it hurts kind of thing and then expect to feel good. And then you need to burn it off. You need to do something else, and you can't continue to eat that way.
So you mean the actual act of walking from the dinner table to the couch to watch football is not enough exercise?
I think those 10 calories that you burn screaming at the television, believing that what you're saying is going to change it, is not going to burn the calories you need.
I was just checking. Just a little hopeful thing going on there. But,
so I'm curious, do you know any good tricks for families? So my family, we do this abysmal thing called the turkey trot. After Thanksgiving, we go on this long walk, right?
Yep.
We didn't do it this year. So I don't know if you could call it a tradition or not if you're throwing it out the window. But are there any things or methods you've seen that help people burn off calories?
Well, I think that's a good idea, especially Thanksgiving is a meal that you traditionally eat a little bit earlier in the day so that you can go outside and play. And how about a little, touch football with your family? There are fun things that you can do that fit in with a tradition that can add in a little bit of exercise and make you feel a little bit better, even on that day.
Pretend like you're the Kennedys. They played touch football all the time. I mean,
yes.
After, of course, they were sailing on the Cape. Though.
Yeah, they had some other advantages that maybe the rest of us don't have.
Thank you, lovely. It was wonderful.
I see them just using those belt machines, that keep shaking you, that rich people used to use all the time.
Now we're also coming up on Christmas, and then following that, we've got New Year's resolutions time. So.
Right.
As a doctor, I'm sure you see people all the time, probably about February, early March, and I try.
By January 9th. I would say most.
Okay. All right.
I would say most resolutions don't even make it that long. I really don't. And that's why, let's be rational. Let's make some good decisions and ones that are going to last.
Which is why health clubs sell you a year's membership and not a week's membership.
They know how to make money.
All right, let's get Mark on the line. Mark, thank you for holding, sir. You are on Talkback with Dr. Kristin Anderson. Hi.
Hi.
Good morning.
I know this Army family back east,
Yep.
and what they do for Thanksgiving is they pick a team, and their favorite team, they do sit-ups since they're easier than push-ups. And whenever they score, they got to do, 15?
There you go.
I
love that idea.
They didn't pick the Grizzlies, did they?
They got to do push-ups, which are a lot harder.
Sorry. That was mean.
All these overweight Grizz fans, what's going on?
They didn't pick the Grizzlies, did they?
Mark, I think that's a fantastic idea.
That is a good idea.
You can just find something that's fun for your family, make it a game, work for physical activity into your day. I love that. That's great.
Unless, of course, the Grizz scores 60 points in a game, then you've got a lot of sit-ups going on.
That's right.
Oh, yeah.
So.
All right, thanks.
Thanks,
Yeah,
Mark.
thank you. That's great.
Appreciate the call, man. 721-1290 is our number. If you have a question for Dr. Kristin Anderson, we'd love to have you.
Now, of course, you're always listening to Talkback, I'm sure, while you're doing your rounds.
And recordings.
Yeah, of course. So while you're doing that stuff, I know you probably listen in. We talk a lot about politics and other stuff besides health here on Talkback during the day. And one of the things I noticed kind of bled into Health Talk I thought I'd bring up today.
Oh, perfect.
A lot of different, everything Washington Post, many other newspapers are advertising or, have articles advocating ways to help families deal with political problems when they come together for the holidays, Thanksgiving or Christmas. I know this will happen in my family, and I think it'll be really interesting to see what coping mechanisms people can come up with, because that's a lot of stress and a lot of sometimes depression that could result from things that other people find trivial, like politics or relationships or whatever, that might be going on in the kids or the parents' lives.
I think it's a really good point. One of the things that I read this year is, some, polite mismanners ways to deal with this is the hostess needs to set the game plan before people come over and say, either we are not discussing that. You need to talk about your sit-ups and that kind of plan, or whatever it is, chit-chat, play games. Or if you're going to have a discussion about politics, you need a designated room. So it's kind of like, the smoking room of yesterday. You just need to go in the politics room. If people want to go in the politics room, have a wonderful time. Go. But everybody else doesn't have to be subject to the
And houses
tension.
Are already designed with a room built specifically for politics. It's the bathroom. Hey, just go in there,
That's
lock the door, and talk about all the stinky stuff going on out there.
It's usually only made for one at a time, John.
yeah. Well, but that would reduce your stress.
That would reduce stress quite a bit.
I think you bring up a good point, though. This is a particularly stressful time of year for families, for veterans. Mark was bringing that up. There are some pretty stressful things going on here. So
We need to take a break. 721-1290 is our number. Dr. Kristin Anderson, always willing to take your phone calls at 721-1290. And about whatever might be on your mind health-wise, she'll take a stab at it. That's a wrong word. I'm sorry.
Take a fork to it.
We're going to be right back. Stay with us. All right, we're back. This is Health Talk. I'm Peter Christian. Dr. Kristin Anderson joining us from Community Medical Center from day one. So go ahead, John.
Yeah, so I had a quick question for you along the lines of the topic we just left off on.
Stress. I think it's an important one.
Well, when it comes to stress and depression, I mean, obviously you might not fully realize how much you're experiencing it. But when we come together for the holidays, it's kind of a time where you get to notice how people might have changed. And I guess my question for you is, how do you pick up on any signs that there might be some problems going on, something you might want to talk to somebody about or help them get help?
Well, one tricky one is, are they overeating? Because sometimes people will manage their stress.
So that's going to be yes across the board.
We're all so troubled.
Everything is wrong with my family.
We are all so troubled.
It's one thing to have a big meal, but if you notice that person, they are overeating constantly all day long, you've noticed some weight changes. I mean, that's one way that people cope with stress. And there are some healthier ways to do it, obviously. Exercise. I would, and talking with their family members or somebody that cares about them. I would say alcohol excessive alcohol use, especially this time of year, is something to watch out for. And then the behavior that goes along with that, drinking and driving and things like that. These are the things to watch out for, because these are the things that, hurt families, hurt people.
So now you're a doctor. So let's say I invited you over to my house, and I'll just use myself as an example. Okay, let's say I grabbed a bottle of scotch and ran into the bedroom and shut the door. Okay. What I mean, how as a doctor, you would say, Peter doesn't ordinarily grab a bottle of scotch
there you go.
run into the bedroom. So, sorry. How would you as a doctor, would you knock on the door and say, hey, is everything all right, or what? What would you?
It depends on the relationship. If you're somebody that I know pretty well and have that conversation and feel comfortable with it and kind of deal with the fallout that could come from that, I think there's nothing wrong that could come from a conversation of just to say, how you doing? What's going on? How's work?
Are you going to share?
Right. Maybe you should bore me. But I think, if it's a more just, second cousin you don't, know too well, or, somebody in law that maybe might be kind of a brush fire if you start that conversation, you can refer them to their doctor. And I think that's a nice conversation to have, is just say, it looks like maybe things are a little bit rough for you right now. There are some people that you can talk to. Let's get you hooked in with somebody.
Wow. So one of the things that I was curious about, it kind of comes up every year. We get the results for the number of suicides in Montana. And Montana is pretty high for per capita, at least in suicide. One of the things people have theorized is that it's because we're in the climate zone that we are, with so little sunlight, and there's lots of other people, lots of reasons people have theorized as to why. I guess my question is, how do you know? I mean, even if it was something I barely knew, and I thought they were getting close to that, I would confront them, right? Or at least try to talk to them.
Or family members, and try to get more information. Again, it depends on your relationship with the person, but there are, suicide hotlines that you can call. So if you're concerned, even a concerned person, then calling a suicide hotline to get some information on how to deal with this and get them resources. The scary part about suicide for a lot of people is that when they sort of get to that stage where they're thinking about completing suicide, they kind of enter sort of more of a calm period and maybe a more quiet period, which they've
already made the decision.
Correct. And sometimes that makes them, a different sort of person, and you might think, oh, things have gotten better, when in fact they have established a plan. So that is a time to reach out too. So pick up on those subtle signals, talk to family members, and get them the help they need, either through a suicide hotline or their providers, or something that is beyond you, because that's a lot to take on too. You don't want to necessarily take that on without professional mental health.
Now, is that something that does seem to increase with the holiday cycle as we go through Thanksgiving and Christmas, or is that?
I don't know the exact statistics on that. I know that, there are different populations that think about suicide. Men, for example, tend to complete suicide. Doctors actually have a higher rate of suicide. They tend to, also complete it. Sometimes there will be people that have a kind of more of a cry for help sort of thing and don't actually complete it. But it depends on your population. I don't know about the exact statistics.
Now, about doctors, is it because they feel this constant pressure to be a healer all the time, that 24/7, even if they're in the grocery store out playing golf, somebody, hey, it hurts when I do this,
Yep. The pressures on doctors, I would say right now, are pretty significant from a lot of different venues.
Sure.
Everywhere from taking care of patients, which, obviously has a lot of pressure, down to,
the government.
How we pay for healthcare comes down to, making sure that you're doing things in a certain way, which, the impetus behind that is not bad. You want to do quality care. But it puts a lot of pressure on doctors.
Well, and small talk's basically impossible for doctors. Like, what's the first? What are
people.
The first two questions? Like, oh, what do you do? Oh, I'm a doctor.
Oh,
look at this!
I tell people, I have a standard answer. I deal in sapphires. That's my standard answer on airplanes and things like that. Wow. So that, and unless I get a ding, and then I go. But
you'll be with Jim Adair, and he'll be, oh, really? Well, tell me.
I happen to have an ailing sapphire right here. What do you prescribe for my sapphire?
Good cleaning.
I'm seeing through you in a heartbeat, lady. You're not fooling me.
Like
you
a
look like a doctor.
Clear sapphire. I see through you.
Oh gosh. So on a personal level,
Sure.
when you look at the holidays, do you plan?
Oh, I made my shopping list for next year.
Okay.
Why make it again?
Okay, so
It's the same meal. I mean, let's get her done.
Okay.
Yeah.
All right.
Absolutely.
Very organized, which is
There-
probably really good
You
skill
want
for
that
a
in your
doctor.
doctor.
Yeah.
catch as catch can.
My wife has a book. It's literally called The Checklist Manifesto on her study desk.
Yeah, there are
I
ways
can't
to
do
do
anything
this.
with going through 15 checks.
So that's
She's a wise woman.
That's right.
All right, and that's why you're wearing pants today. So we're
Peter technically
not
cannot
the only
see,
reason.
just so we all know.
we're going to take a quick break. 721-1290 is our number. We have way too much fun when Dr. Anderson is here. So give us a call if you have a question. We'd love to hear from you. It's 721-1290. 721-1290 is the number. This is Health Talk. Dr. Kristin Anderson joining us from Missoula Community Medical Center from day one. John King's over there. I'm Peter Christian. We were just kind of kicking stuff around during the break. And one of the things that people have to learn how to do as they become adults is learn how to cope.
I hope so.
There are all sorts of things that can happen, especially during the holidays.
Yeah.
If things don't go as they thought, you have this idealized deal. Well, my Christmas or my turkey dinner failed, or my Christmas party didn't go, or
Didn't get the Red Ryder BB gun.
whatever
That's
it might be. So as a physician, when you talk to people about there are physical as well as mental ways of coping, right?
Yep. Oh, absolutely. And I think one of them for both, and a lot of people would argue it's not even separate. And I agree. You in terms of coping, you just have to set realistic expectations. Things are not always going to be perfect. They're not going to look like they do on TV. Families are not TV families. There's no script. It's not going to end the way you want it. And no matter how hard we try, you can't control everything. An example I can give you is on Wednesday, before Thanksgiving, we got an energy audit. And in our energy audit, they noticed something wrong with the carbon monoxide venting in our home. And they said that you might have to shut off your hot water heater. And this was about 4:00 on Wednesday, and I had a number of people coming over to my house, and so I gave that kind of look.
Oh, really?
Yeah. Oh, really?
I don't suppose I can
This
put
is
that off for
Montana.
a couple of days. Can I?
And so,
How about if I come to your house and wash all my dishes?
but I will say that what I did, when I was talking to my daughter about it, because I'm really concerned about this. She's growing up in an age where, if you don't get the right stuffed animal, people fall apart. And I don't want her to live that way, because the world is not going to work that way. And I talked to her and I said, you know what? We are making memories. And she said, what does that mean? And I said, well, this might be the year that we didn't have hot water.
It's a wood fire on the front porch.
And my husband tried really hard. He tried to explain to me that we didn't need hot water to cook Thanksgiving dinner, and that one is going to stick with me, and I will laugh about it someday.
Well, the nice thing is if you put water on the stove long enough,
Yeah,
it will boil.
It will, and I guess I'll wash my hands. I mean, I went through mercifully, it was okay. They had it checked out, and we can get a new one, and everything's okay. But humor, trying to look at the bright side, reframing. These are things that you can do to cope with the stress that is inevitably going to happen at 4 p.m. before Thanksgiving.
Now, go ahead.
How do you attain a realistic vision of what's supposed to happen? And see, the problem is...
Turn off your electronics. Number one.
Well, even for many of us, the vision that we have of what Christmas should be is something we've had already experienced, like
yeah.
a past Christmas when my sisters got along, or when my mom and dad didn't fight, or whatever it might be.
The days of yore.
And you're hoping that happens again, and of course everyone's old and grumpy again.
Yep.
So, so how do you kind of tune yourself into a reality check?
Well, I think sometimes it comes down to, if you're hosting, lay down some ground rules. This is how we're going to behave, and you want to model good behavior for our kids. That there are certain standards of conduct, and you are allowed to say that, especially if you're hosting.
Believe it or not, we're coming to the end of our time. So
blink.
tantrum
A blink
time, tantrum
with
time.
you
Yeah.
too.
We just had to
It's a
drop a
blink.
standard of conduct on you
So
there.
how can folks get in touch with the community and get actual real medical advice from our doctor?
That's right. So 728-4100 or communitymed.org. They'd be happy to help you out with any questions that you have.
It is always a pleasure having you.
Same here.
Because you put up with our nuttiness. I don't know how you do it. So anyway, but thank you. We appreciate it. Hope you had
My
a wonderful
pleasure.
Thanksgiving
You
and
too.
a happy Merry Christmas to you and Happy New Year as well.
Everybody out there too.
All right, thanks. Appreciate it. All right, that's going to do it for Health Talk. We have an hour of open phones coming your way on Talkback this morning. John's been very busy cataloging stuff, so we will have that right after the top of the hour.